Hey everyone, we are covering the male reproductive system today. So the primary functions of the male reproductive system, which is the testes, are to produce sperm and to produce the sex hormone testosterone. Make sure you label your picture on your notes so you know what parts are what. So for the male, you have the scrotum sac that sits on the outside of the body and it holds the testes. So there are two testes in the one scrotum sac. There are, in their job, they produce sperm. And then there are two epididymis that are sacs that sit on the top of the testes, and they are where sperm matures. And then there are two vas deferens, these long tubes that transport sperm up from the testes. And then there are two, which you can't really see from here. Here's this view, two seminal vesicles. So there's one here and one here that feed the sperm. So they produce a sugary solution that feeds the sperm. And then there is the prostate gland, which is it produces fluid to protect the sperm because the urethra is a very acidic place and it can kill the sperm. So it provides that solution, and there's only one prostate. And then the bulbourethral glands are down here, and these glands also produce a solution that protects sperm as well, and there are two of those. And then the sperm is ejaculated through the urethra that runs through the penis and out of the body. And then the urinary bladder, where urine is stored, is here. And the urethra runs from the bladder and through the penis. So sperm and urine exit the body through the urethra and through the penis. And then the colon and anus are back here. The penis is 3 cylinders of erectile tissue. It is not a muscle, meaning you cannot work it out to make it bigger. You get what you get. And there's no bones in the penis. The skin on the shaft of the penis is hairless and wrinkled to allow for expansion during erection. And the most sensitive part of the penis is the glans, or the head of the penis. Every male is born with a foreskin, which is a circular fold of skin that covers the head of the uncircumcised, the head of a penis. And then depending on parents' choice, religion, culture, whatever the reason, a parent might choose circumcision for their child, which means they remove the loose skin that covers the head of the penis. Some people do it because they worry about infection, because you have to make sure that you really clean that well, pull the skin back, and it can reduce your risk of infection there. But there's lots of people that are not circumcised and they do just fine with that. So I'm not sure that there's a right or wrong answer. Some people are very passionate about that topic and don't agree with it. So some people compare circumcision to genital mutilation that happens to women in other countries. And the purpose of genital mutilation is very different than circumcision. So while for women, for genital mutilation, they take and they cut the clitoris, and they make it so that women feel pain during sex and not pleasure, because they don't think women should feel pleasure during sex. But for men, that's the original purpose of circumcision was to curb masturbation, because they used to think that it was immoral to masturbate, which is ridiculous. But that's where it started, I believe. Other cultures don't necessarily do that for that reason anymore. We here don't do that anymore, but if you watch the history from it. But it does not stop you from feeling pleasure by being circumcised. So they're different. Genital mutilation and circumcision are very different. Urethra is the tube that passes through the penis to the outside of the body, and again, it carries sperm and urine out of the body. An erection, in order to have an erection, which is you need blood rushing to the tissue to cause the penis to become erect and be able to have intercourse. It's triggered by sexual thought, sight, or touch. And erections are very common during puberty. Actually, erections are common from birth on. When little babies have erections all the time, and it doesn't mean that like they're turned on by something. It's just something that they can't control. Nocturnal emissions are wet dreams. That means ejaculation happens during sleep, and it's especially common during puberty. Ejaculation is the ejection of semen from an erect penis. Muscles in the reproductive system and the base of the bladder contract and cause semen to be forced out through the urethra. First ejaculations typically happen around puberty for boys. And with each ejaculation, there's about 100 to 600 million sperm cells that leave the body in that ejaculation. And if a male has 10 million or less, he is considered sterile, meaning he cannot have kids the natural way anyway. And then the ejaculatory duct is a duct that opens during arousal, and then it closes on the urethra where the bladder is. So remember, the urethra carries both sperm and urine. And so the duct closes on the urethra where the bladder is. So during ejaculation of semen, you don't urinate inside a female. The scrotum is the loose pouch of skin that hangs on the outside of the body and holds the testes. And the reason the testes need to sit in the scrotum and outside of the body is that the testes, in order to produce healthy sperm, have to be at a temperature of 89 to 93 degrees. The human body is about 98.6 degrees internal temperature, okay? And so if the testes if they were inside the body, the sperm would die. They would be fried up, and they would not be able to do anything, travel into the female and to find the egg and all that. They would just die. So that is why. And then the cool thing is that there's a muscle, you don't control it, okay? It's called a cremasteric muscle. So when the scrotum sac, if the testes get too cold, the cremasteric muscles will contract and they will pull the testes or the scrotum sac closer to the body to warm the testes. And then if they get too hot, the cremasteric muscles will relax and cause the scrotum to fall further away from the body to allow the testes to cool off. So if you people talk about jumping into a cold pool, it's true. Like the testes will retract or contract, or the cremasteric muscles contract and pull the scrotum really close to the body to try to warm them from the shock of that cold water. There are 2 testes in the one scrotum sac. Millions of sperm are produced each day, and it takes about 60 days per sperm to fully form. Sperm can live in the vagina for an average of 3 days. There are super sperm that can live up to 7 days in the vagina, and they give the greatest chance of pregnancy. Because if you have intercourse the week of ovulation, you could still have sperm cells present when the egg releases. And then sperm can live outside the body for 10 to 20 minutes. Some penis facts. The actual amount of semen per ejaculation is 1 to 2 teaspoons. The average number of times a man will ejaculate in his lifetime is 7,200. The average total amount of lifetime ejaculate is 14 gallons. It takes 35 gallons of water to fill a tub. The average speed of ejaculation is 28 miles per hour. An average city bus goes about 35. The largest penis in the animal kingdom is the blue whale at 11 feet. The height from the floor to the rim of a basketball hoop is 10 feet. And then odors that increase blood flow to the penis are lavender, licorice, chocolate, donuts, and pumpkin pie. All right. So we said the two major functions of the testes are to produce sperm and to produce testosterone. Okay, so that testosterone is the male hormone that gives them the male characteristics. Male teens produce 6 times as much testosterone as older men, and levels are highest the first thing in the morning and in the fall. And testosterone gives men longer, heavier bones, larger muscles, thicker skin, deeper voice, body hair, and increased basal metabolic rate. The epididymis, those are those storage sacs, or it's actually coils that make up the epididymis. It's all intact, and so it's only about 3.8 centimeters, but they say if they uncoil it, it's over 20 feet long. And it stores sperm for 1 to 10 days. Then the vas deferens, I said, transports sperm from the testes out of the scrotum to the urethra. And then a vasectomy, this is male sterilization, meaning if you say, okay, I don't want any more kids, I'm going to have a vasectomy so that I can't get my wife pregnant. And so they would go in for a procedure called a vasectomy. And so they take and they make a small incision in the scrotum on one side. And if you can see here, you can actually see the vas deferens, that long tube here, okay? So they make the incision and they isolate, they take out not take it out, but they take part of it out and they cut a piece off, and then they tie up or cauterize or burn, close the ends. And then they elevate the scrotum to put the vas deferens back in place, and then they'll do the same thing on the other side. And so when completed, both sides will look like this. So that sperm is still being produced, you're still producing testosterone, okay, but it can't get out of the body, okay? And so people think, oh, well, they had a vasectomy. When they ejaculate, they're going to ejaculate nothing. No. All this does is produce sperm cells. All of the fluid in semen come from all of these vesicles and glands up here. So most of what sperm cells swim in are from the seminal vesicle, the prostate, and the bulbourethral gland. So there's still the ejaculate that's going to come out. It's just not going to have sperm cells in it. And they have to wait actually many months and have a certain number of ejaculations before they're considered sterile. And they actually have to go in and give samples to the doctor. The doctor checks to make sure that their levels are low and that they can't get their significant other pregnant. I went over all of those already. So again, the testes produce the sperm. The epididymis is where they go up and are stored. So testes produce sperm. They're stored and matured in the epididymis. They travel through the vas deferens, pick up sugary solution in the seminal vesicle, pick up fluid in the prostate, pick up fluid in the bulbourethral gland, and then ejaculated through the urethra, through the penis, okay, from an erect penis.